Dalam perawatan, terutama perawatan melalui salur darah, penggunaan peralatan perubatan yang canggih dan terperinci amat perlu bagi memudahkan doktor untuk mengesan dan merawat penyakit seseorang pesakit. Angiografi adalah salah satu dari prosedur radiologi untuk mengkaji saluran darah di dalam arteri atau vena. Untuk pemeriksaan X-ray biasa, saluran darah tidak dapat dilihat. Media kontras akan disuntik ke dalam salur darah anda untuk memperlihatkan saluran darah dalam kawasan pemeriksaan. Pakar radiologi akan memasukkan tiub nipis dipanggil kateter pada pangkal peha iaitu arteri femoral atau di atas lengan atau arteri brachial untuk suntikan media kontras. Begitu juga pesakit perlu menjalani prosedur imbasan CT atau computed tomography bagi pengambilan imej-imej yang akan diteliti oleh pakar radiologi. Kini dengan perkembangan pesat dalam dunia perubatan, lahirlah mesin Angio CT Hibrid yang menggabungkan fungsi kedua-dua mesin angiografi dan imbasan tomografi berkomputer atau CT scan.
Let's look back the history of radiology more than 100 years ago. Before the discovery of X-ray by Conrad Röntgen in 1895, to look into the body without cutting open was a dream. The only way we can look into the body was through open surgery or autopsy. But after the advance of X-ray, many things can be done without cutting open. And over the last 100 years, the technology and development of X-ray equipment was so tremendous, and has brought the technology into the next generation. By the today's standard of art technique, many things can be done without cutting open.
Mesin Angio CT Hibrid berfungsi bagi meningkatkan keupayaan rawatan pelbagai penyakit melalui kaedah intervensi radiologi. Mesin ini menggunakan teknologi baru menggabungkan dua teknologi iaitu angiografi dan imbasan tomografi berkomputer atau CT scan. Melalui penggunaan mesin ini, ketepatan diagnosis dan rawatan bagi penyakit tertentu seperti kanser dan tumor, khususnya bagi kes rawatan yang kompleks, dapat dipertingkatkan.
Interventional radiology is a relatively new subspecialty in medicine. It has been in the world for more than 40 years, and it is a minimally invasive treatment technique by the use of needle, wire, and small tubes, we call it catheter. It is a form of pinhole surgery without cutting open the body, and by using this technique under the help of or under the guidance of many types of X-ray equipment like ultrasound, CT scan, angiography system, or hybrid angio system, we can carry out many forms of surgery without cutting open. The technique involves the use of needle, wire, and tube by introducing these devices through the artery at the groin or at the wrist or through the vein in the groin. We can travel to the brain, to the heart, to the lung, to the liver, kidney, intestine, or down south into the pelvis, like uterine fibroid, into the bladder, into the prostate, or down the leg. With this technique, we can institute all kind of treatment in treating the diseases as well as helping the patient.
Sistem ini mengintegrasikan pengimbas CT dan unit angiografi dijalankan serentak tanpa perlu memindahkan pesakit ke unit mesin yang lain. Dengan ini, ianya dapat memudahkan pakar radiologi dalam mendiagnosis dan merawat pesakit di samping dapat mengelak berlakunya jangkitan infeksi sama ada dari jarum atau kateter yang digunakan semasa prosedur angiografi. Pesakit tidak perlu dipindahkan dari meja atau ke bilik lain untuk tujuan ini. Tempoh prosedur juga dipendekkan, justru mengurangkan masa menunggu keseluruhan. Sistem ini digunakan untuk pelbagai prosedur onkologi intervensi.
Most hospitals treat the diseases using interventional radiology technique either by the use of ultrasound, CT scan or angiography systems separately or together. The hybrid angio system is a system we combine the CT scan and the angiography technique where it enables us to be able to selectively and accurately pinpoint on where the tumor or abnormal blood vessel is, and from there we can precisely determine whether we have achieved a targeted territory and we have complete the treatment or not. A good example is in the treatment of liver cancer, for instance. By introducing the tube into the liver through the groin, we are able to precisely localize whether we have gone to the area where the tumor is. And after delivering the chemo drugs, we can tell whether we have completely blocked off the abnormal blood vessel or sealed off the tumor. And with that, we can actually be more precise, more accurate, and more effective in instituting a treatment, and hence better clinical outcome. With this technique, we also can combine and widen the scope of services to go into treatment of the tumor in the chest, okay, treatment in the brain and spine and other body parts. So the use of hybrid angio systems actually has frog lab or perhaps enhanced the standard of care, improving the accuracy and clinical outcome, as well as it make many treatment not possible before doable by the current standard of technology.
Prosedur angio CT hybrid sesuai dalam pengendalian prosedur CT arterioportografi atau CTAP dan CT hepatic arteriografi atau CTHA. Gabungan prosedur CTAP dan CTHA ini merupakan modaliti yang paling sensitif dalam pengesanan penyakit hepatocellular carcinoma atau HCC. Proses ini penting dalam penentuan sebelum proses chemoembolization atau TACE dilakukan. Penggunaan sistem koordinat 3 dimensi atau 3D, prosedur CT angiografi pada arteri yang disasarkan untuk proses embolisasi boleh dikenal pasti dengan jelas dalam image 3D.
The role of interventional radiology are, number one, to complement the surgery, where open surgery, when it becomes very dangerous or when the patient is not suitable to undergo the major surgery, interventional radiology can help in overcoming the critical stage of the management and keep the patient through for the subsequent management. Interventional radiology also plays a role of replacing surgery. Many forms of operation can be done through this means without cutting open. It also plays the role of augmenting the treatments of many conditions by making the medical treatment or surgical treatment more efficient and less traumatic to a patient. In many instances, a lot of diseases are not treatable medically or surgically. By the use of interventional radiology technique, this can be addressed in one way or another.
Mesin ini mempunyai resolusi kontras yang tinggi dan pandangan skrin yang lebih jelas untuk kegunaan pakar radiologi dengan dos radiasi dapat dikurangkan. Mesin ini juga mempunyai kelajuan imbasan yang lebih cepat dan dapat memberi manfaat dalam sistem CT atau angiography hybrid jika dibandingkan dengan resolusi mesin-mesin sebelum ini.
The advantages of interventional radiology in instituting the treatments are, number one, because it is minimally invasive and pinhole puncture, it has less pain, more rapid recovery, less trauma to the patient, and in many instances it can be done under local anesthesia and on the outpatient or daycare basis. And it also reduces the cost of treatment, especially in the critical situation where open surgery or prolonged ICU stay are needed. Interventional radiology also widens the scope of treatment, where previously many conditions cannot be treated and you can treat by this means. It's just like an example of repairing a leaking pipe. Instead of break down the whole house to identify where the source of bleeding, the source of leak is, we can go through the pipe by putting the wire and tube and see where the hole is and sew it off internally. This is just a basic example.
Mesin Angio CT Hybrid ini dapat melakukan rawatan intervensi radiologi iaitu meletakkan ubat terutama untuk mengecilkan tumor atau kanser dalam organ badan dengan lebih tepat. Selain meletakkan ubat di organ dalaman di kedudukan yang tepat tanpa menjalani pembedahan utama, mesin Angio CT Hybrid akan mengurangkan pendedahan radiasi kepada kaki tangan yang bekerja di ruang intervensi. Kelebihan sistem CT angiography hybrid ini ialah kateter atau jarum dilakukan di bawah panduan CT fluoroskopi secara masa yang nyata. Dengan ini, pakar radiologi dapat melakukan prosedur ini serentak dan cepat.
The kind of diseases we can treat using this technique, generally there are two varieties. One is vascular, another one is non-vascular. In the vascular disorder treating by interventional radiology technique, we can use this technique to go through the artery or vein to block abnormal blood vessel, like when the artery is bleeding, like in the intestine, in the brain, or in the nose, or in the uterus. We can block off the abnormal blood vessel, and this technique is called embolization. Of course, on the other hand, we can also unblock the abnormal arteries or blood vessels, for instance, in the stroke. This technique allows us to go into the brain, put a wire across, do an angioplasty, and insert a stent, and to re-establish the blood flow to the brain. Similarly, we can use certain devices, we call it mechanical thrombectomy devices, where you can retrieve the blood clot from the brain and hence can treat a stroke.
Prosedur ini tidak menyakitkan. Anda mungkin akan berasa panas atau merasa pahit di dalam mulut semasa media kontras disuntik. Pesakit akan diminta untuk menarik dan menahan nafas selama beberapa saat dan beberapa siri imej X-ray akan dirakam. Kateter ini akan dikeluarkan selepas selesai prosedur tersebut. Tekanan akan dilakukan pada tempat kateter dimasukkan untuk menghalang pendarahan.
The the non-vascular type, where intervention radiology technique allow us to insert the needle and devices directly into the organ system. For example, if you have a tumor in the lung or in the liver, we can insert a needle by the technique we call RFA, radio frequency ablation. Alternatively, we can use different needle like microwave or cryoablation. This technique can kill the tumor by heating out the tissue around the needle to 100 degrees Celsius, and hence it will kill the tumor. This is called tumor ablation by using RFA or microwave. On the same technique, we can bring the temperature in the cell down to minus 20 to minus 40 degrees Celsius. That will also kill the tumor. This is called cryoablation. And all these techniques are available in the country many years back, and these techniques are available in all the tertiary hospitals, either the government hospital or private institutions. So the public should make aware that in Malaysia, these techniques in treating the cancers are easily available nationwide.
Prosedur lain yang boleh dilakukan adalah seperti TACE, iaitu Transarterial Chemoembolization. Prosedur ini dilakukan kepada pesakit yang mengalami kanser. Prosedur ini dilakukan dengan pemberian ubat kemoterapi melalui kateter ke pembuluh darah yang memangkin pembesaran tumor dan seterusnya dapat menutup atau embolisasi saluran darah tersebut bagi tujuan mematikan tumor tersebut. Ketepatan diagnosis dan rawatan bagi penyakit tertentu seperti kanser dan tumor, khususnya bagi kes rawatan yang kompleks, dapat dipertingkatkan. Mesin ini dapat mengesan bahagian yang diserang kanser dengan lebih tepat dan memasukkan ubat di kawasan itu sahaja, selain boleh memudahkan proses menutup saluran darah bagi mengecilkan tumor. Kadar kejayaan sesuatu operasi, penyembuhan pesakit boleh dipertingkatkan selain jumlah pesakit yang perlu melalui pemeriksaan CT scan dan angiografi dapat dipertingkatkan.
With regard to the clinical outcome, interventional radiology being minimally invasive, it has many advantages. For instance, less cost, less pain, can be done under local anesthesia and on outpatient basis. On the other hand, because this technique utilizes super selective or very targeted technique, so the damage to the other body, other organ or surrounding structure can be minimized or perhaps is negligible and less complications. It also enhances the recovery, and the success rate is very high with minimal complication. On the other hand, I have to mention that being a procedure-based treatment, the clinical outcome, success rate and complication is very much depends on each and every doctor's capability, training, know-how and skill.
Kini, pesakit cenderung membuat pilihan kaedah radiologi intervensi berbanding pembedahan secara terbuka kerana kadar penyembuhan yang cepat dan tanpa insisi pembedahan yang besar. Faktor kos juga memainkan peranan penting dalam pemilihan prosedur perawatan. Kaedah ini jauh lebih murah jika dibandingkan dengan pembedahan biasa. Selain daripada itu, tempoh penyembuhan juga cepat dan dapat mengurangkan jumlah hari dalam ward dan dapat menjimatkan kos.
With regard to risk of infection, it is very low with proper sterile technique. So overall, the complication rate is very low, less than 5% or lower, perhaps in most instances we do not see any major issue. And the success rate also depends on the type of treatment we are doing. For instance, in treatment of liver cancer, depending on the size of liver cancer, we can achieve as high success rate of 90-95% or perhaps 100% in small tumor. In big tumor, we may be able to achieve 60-70%, or the more important thing is that we are all able to offer palliative treatment in controlling the disease, prolong the life, improve the quality of care, restore the physiological function of the body, and offer a better quality of patient in the remaining years instead of suffering from other more aggressive or more complicated surgery or treatment options.
Prosedur ini menggunakan peralatan yang canggih dengan kos yang agak tinggi juga. Namun kaedah ini merupakan satu kaedah rawatan yang unik kerana tidak memakan masa yang lama serta tidak memerlukan pesakit menjalani sebarang proses pembedahan yang rumit.
Dengan teknologi sekarang yang terkini, pembedahan boleh dilakukan tanpa pembedahan terbuka ataupun open surgery. Kita akan membuat pembedahan menggunakan artroskopi, teropong.